we're in South Louisiana. Anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting.
So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
All right. Good morning, everybody. Thank y'all for jumping on with us for another Tea with Dr. D. Join me for my little tea time and answer a few questions for y'all. I hope everyone is doing well. Things are kind of getting back up and going and starting to kind of proceed and grow. And we're starting to get moving around. And I know there's at least from kind of our standpoint here at the office, we're starting to see more and more of y'all. So I'm very glad to see y'all's faces and talk to you and see how the last few months has been. So thank you everyone who reached out after the last show and asked us all the questions that we have. We're trying to work through them. Please bear with us. We'll keep sending them in. I want to know what y'all are questioning, what y'all want to know. What can we help with? How can we make this more informative, make this more helpful? So by all means, send us a text message if you have questions. That's a really great way to reach us. We can kind of communicate at least in some semblance of a one-on-one fashion and answer questions as we go, or we can answer questions here if they're sent in that format. So jump on. If y'all have questions, please put it in the chat. Share the show. If you know some people that need to hear some of this information, they need to hear some health stuff, they need some positivity. Please share this to them, tag them in the comments, get them on here. If there's stuff that you need to tell them, tell me, let me tell them that stuff. So with that, we'll dive in. We got quite a bit to get through today, so we'll get rolling with it. So we did get a couple of questions about kind of phase 2 and what was going on. I'll get to that in just a minute, but kind of what we were doing. We've gotten a bunch of questions from y'all about come and float, come and do cryotherapy, come and do infrared and PEMF. With phase 2, we are starting to open all of those kind of spa and integrated health activities for you. Please call us for that. We're trying to schedule it very strategically. So please give us a call if you want to get on that schedule, if you want to come do a cryo session, if you want to come float. We're still doing some things and having some specials to try and help everybody kind of get back going with all of their kind of health activities. So call us, call the office, 504-5144. If you are interested or want to do some of that stuff, reach out. We're starting to get a lot more people in, and I know what the last few months have looked like for a lot of us. And some of that's been low activity to high activity, and we're getting a lot of people who are coming in with little aches and pains. So if you have some of that and you want to jump in there and do a float and just relax with all the kind of stress that's been going on, let us know. If you want to zap some inflammation and kind of rejuvenate all the cells and do like a cryo plus session and do the infrared, let us know. We're opening all that stuff back up. Like I said, we're doing that kind of by appointment. So please call us and we'll get that stuff going. So with that said, let's answer some questions. Good morning. Good morning, Jody. Good morning, Billy. I hope y'all are doing great. I hope everybody who's joining us, please drop a comment. Let us know. Say hi. So we got quite a few questions. I'll dive into them. And if y'all have some, just chime in. So for shoulder pain and impingement, we see this a lot in today's environment because so many people are so tight in their chest. We sit so much and everything's in front of us now. So we've got, our steering wheel, our phones, our computers, everything is here. And a lot of people are starting to tighten up through the front of the shoulder, the front of the pec muscles, through the front of the neck. And that's causing a lot of restriction when we go to start moving. So they're getting really pulled forward and really compressing that shoulder. And that's causing them, every time they do simple movements, you're reaching to grab something out of a cabinet, that puts a lot of pressure in that shoulder joint. That actually is what creates that impingement. And so there's some pretty easy things. We can actually do some very simple things to relieve that impingement. So the first part of that, if you're suffering with this, if you've got some shoulder pain, if you've got some degeneration in there, even if you've had a doctor who said, hey, look, you've got some arthritis or something like that in there. If we start by ungluing that joint, if we start by loosening up all of that tissue across the front and we let that shoulder kind of fall back where it needs to be, that's going to allow kind of that pain-free range of motion to come back, regardless of what's happening in the joint. So there's a couple of easy things for that. First, and most importantly, go and get you one of those over-the-door pull-up bars that you just kind of rest. I think they're like $15 at Academy. Get one of those and start for the first 5 days that you have it. Hang for 5 minutes a day. So that can be, 30 seconds to a minute, and just hang palms facing forward and just let that shoulder kind of open up. Let that traction kind of pull that shoulder forward and stretch all of that deep capsule tissue, stretch all of these tight muscles that are across the front. So the first 5 days, we're going to hang for 5 minutes. The next 10 days, we're going to hang for 10 minutes. So we're slowly kind of increasing how much mobility we have in that shoulder. So that alone is basically number one. If you can start doing that and start opening that shoulder up, you'll start to stretch all those deep tissues, and that'll take a lot of that tension off, and that'll actually, for the most part, cure that impingement depending on where you're at. So the second part to that is start loosening up the chest and the upper back. Use one of the little alpha balls that we've talked about so much, and do that one that everybody loves. Start laying on the ground and start kind of rolling through all of that tight tissue. Start ungluing that deep pec major, pec minor. Start really kind of pinning that down and working through that. If you do those two things and you start doing anything to loosen the upper back and neck up, we've talked about kind of rolling out the back, get you a foam roller and stuff. But truthfully, start with the hanging, start hanging and opening that shoulder up. 5 minutes a day for the first 5 days, 10 minutes a day for the next 10 days. So in those 15 days, you will see dramatic changes in how good your shoulder moves and how much pain you have in that shoulder when you're doing that stuff. And I've had a few friends that are orthopedic surgeons start telling people to do this, and quite a few of them have seen, on like a 6-month follow-up where someone said, hey, I got treatment, I've been hanging, I'm not having any pain anymore. What does my shoulder look like? On a follow-up MRI, quite a few of these surgeons have said they see actual structural changes in that. Bone spurs that got better, impingement and kind of tendinitis go away. So it's a really, really easy program for you. A lot of people in the beginning, if you can't get arm overhead to start hanging, start with it kind of in front of you and start kind of leaning back. And as you get through those 15 days of the hanging program, you'll start to get to where you can actually have the arm straight overhead and hang and actually really traction that. Don't do it in a position that hurts. So find the angle and the width that doesn't hurt for you. But if you do those couple of things for shoulder impingement, you'll relieve that completely and clear that all the way up. So I really see a lot of improvement when people start doing that stuff. So give that a shot. Hang 5 minutes a day, first 5 days, 10 minutes a day for the next 10 days. Start rolling the chest out, grab you a foam roller, start loosening up the upper back. You'll see some crazy improvements in your shoulder, and the pain should follow that. So hope that helps. Let me know if you have any other questions about any of those things. Say some good mornings. Good morning, Star. I hope you're doing great. I hope y'all are hanging in there. Christy, good morning. I hope you're doing really well. Hope everything is healing up for you and doing great. So if y'all have any questions, let me know. We'll kind of keep rolling with some of the backlogs here. Can you recommend any nootropics? So for those of you who don't know, nootropics are like smart supplements, smart drugs, so to speak. Those are kind of the latest, I don't even want to call it a fad, but focus of a lot of these different kind of companies that are coming out. Silicon Valley was a really big place for people using the prescription drugs for focus and for, intelligence, memory, a lot of that. If y'all remember the movie Limitless that came out, they started, that was kind of on the early end of how much people were paying attention to these smart drugs. What can we do to help our memory, our focus, all of that stuff? And this has been a big hobby of mine. I've looked into this a lot. And, one thing that we look at, that we start to talk about whenever we, start taking a nootropic, you want to start taking a supplement that's for brain health, for memory, is why. Like, what are you trying to do with that? That's a big part of it. I think making sure that you are doing it for the right reasons is very important to make sure you're successful with these things. But there's a lot of great stuff out there, and a lot of it really puts us in a direction where we do make our brain healthier, and that's why it functions so much better. That's why we have better memory, and it's a hard thing to know, like, am I having better focus? Am I having better memory? So I really try and push people towards things that have good evidence behind them, because you can take one and say, like, I think I'm remembering more. I think I remember people's names better, or whatever it might be. And how do we really know? So in a lot of these, we really want to find some of those medications or supplements that are backed by science, and with the understanding that there's no free lunch with this stuff. Like, you can't take something that's going to increase your brain activity and get that for free. So the number one smart drug or nootropic is sleep. Like, good sleep fixes a lot of these things. So if we're having trouble sleeping and you're not getting that good rest, you can take all of the things that we'll talk about here in a minute, and it's really not going to affect it all that much. So we need to be getting really good quality sleep for your brain to function really well, for you to have great memory, for you to consolidate all of those memories and all the information that you're studying, for you to actually kind of function at a high level. So that's number one. Do all the things that you need to do to get good sleep. Start tracking your sleep if you're not tracking it already. Start looking through all of your activities. Set a caffeine curfew, all of the stuff that we've talked about for getting good sleep, I think trumps all of this stuff if you're not getting good sleep. So I love sleep as well, Christy. With that said, there is some stuff that we've experimented with that really seems to help and that has good research behind it. One is something called ashwagandha. This has been kind of around for a long time. There's all types of claimed benefits for it. It's actually been studied pretty well for short-term recall, for active recall of information. And that's like, if you're in a conversation with someone and you're trying to think of, like, what's that song? That's active recall. What someone's name is, all of that is, can your brain go and grab the information that's in there and do it in a quick time? Ashwagandha has been shown to do that pretty well. I like this, the KSM 66. This stuff works pretty well, and you really do feel like you're focusing better. You feel like, I'm not missing the beats so much. I'm not going to try and find information and racking my brain so much. It just seems to come faster if you've been taking it for a little while. I really like to do this, and like everything, we combine things. I really like to take ashwagandha and then combine that with PEMF a couple times a week, where you're actually targeting the head with the PEMF. Do this at your own risk. I'm not telling you to do anything. I'm telling you what I've experimented with that seems to help. So taking ashwagandha and going and wrapping your head with a PEMF mat and running some sessions to really increase blood flow and circulation in the head and the brain and the brainstem really seems to move the needle for me. I've talked to a lot of people, same thing. So ashwagandha would be one that I like a lot for kind of enhancing that memory, that short-term recall. For task specific stuff, like if you're writing and you need to do like tasks and stay very, very focused in that moment, I am a big fan of this little Alpha Brain. Alpha Brain it works a little different. It's not something I would take all the time. It's not something that I would dive into as an everyday thing. But if you know you've got a few things that you want to work through, or you're writing and you need like a blocked off period where, you know, you're blocking out outside distractions, this is a really good one. If I'm recording a conversation or if I'm trying to sit down and write, I'll take this and kind of, you know, put the headphones on, put a song on loop and just dive into it. And it really helps you to kind of focus on very task specific things. Same thing. This has some really good studies behind it. They've done some double blind studies with it. So that's a good one for y'all who are kind of looking for that type of activities. If we're trying to get to kind of some of the big guns, my other favorite is something that new. We just got this. This was created by someone I've worked with. This is called blue carnitine. And it's a mixture of some really, really wonderful nootropics. So they've combined a bunch of them. And what this looks like, this comes in like these little mints. So let me see if I can get that out for y'all. So it comes in these little like tiny blue squares that you can, they're quartered. So you would just take one little quarter and just kind of put it in your mouth and just let it dissolve in your mouth. And this has something called methylene blue in it. So you'll get a little blue with it. And hey, look, that's kind of some of the fun there, but it is really, really amazing. Methylene blue has been shown to increase, I'm a nerd out on y'all for a minute because I love this stuff. So it increases the electron donor. So it gives extra energy to your mitochondria. That means that your nerves and your brain can function at a higher level faster without kind of running out of energy. So that's pretty amazing. It increases coenzyme Q. That's a big part of kind of brain and nerve function. I will say, like, if you take SSRIs, be careful. I would probably check with your doctor or neurologist about that. But other than that, really, really safe. Methylene blue has been shown to be beneficial for people with like Parkinson's. So that's how much it affects the nervous system and has some amazing capabilities to improve long-term memory as well as short-term. A lot of the nootropics are short-term memory because I think they just can't act that deep. And so taking something like this really helps even get into some of those long-term memory and actually information consolidation. So I think these other ones aren't as much into, like, if I read a book and I'm studying something, can I actually take that information and consolidate it and store it really well to where I can kind of go and pull that information and use it? This actually helps with that. So that's another really good way of kind of going in. If you've got a big test coming up, maybe get you some blue carnitine and use it for that. It's got a couple other compounds in it that really help out kind of that blood flow to the brain, help your brain and the nerves and the cells function at a higher level. There's something called hypocana that actually decreases stress and anxiety and acts as an antioxidant in the brain. So that helps, because one thing that we've talked about when it comes to taking nootropics is, if we think about studying and we've got a nootropic and our brain is operating at a higher or faster level, that's going to use more energy. When we break down energy in our body, even if that's in the brain, there's a byproduct to it. It's almost like when you go faster in your car, you're burning more gas, which means you're putting more exhaust out. We've got to be able to clear that exhaust out, or at some point, you're going to start creating some trauma in there. So they've been really smart about this, that they actually put the antioxidant in there to help not only increase your brain function, but to help it kind of clean out any, exhaust that might come from that. So this one's neat. Same thing. Like, I wouldn't use any of this stuff every day, but if you've got like big tasks coming up, or you have a day where you're like, I need to be on this one, you feel like you start taking this, and about 30 minutes in, you kind of feel a little tingly. you almost feel like you drank some, like a big cup of coffee or something like that. But I love it. And look, I think, having something that's got a little bit of fun, you get a little blue in there. People will ask you about it, and, then we can kind of talk about how smart you are and explain that to them. But, so this is from a company called Smarter, Not Harder. If you go to Troscriptions, TRO, and then like scriptions, like a prescription, they are a really, really medical backed company. Dr. Ted is the guy that made this, and he does Home Hope. Y'all have heard me talk about health optimization medicine and health optimization practice. And in some of our conversations with some of his other doctors, they brought this up, and I was like, send that to me. I want to try that out. So it's a really, really ethically developed company, and they trying to find ways to help people improve their health. And part of that has been kind of attacking some of the mental focus and memory. So I love that one. So those are kind of the major ones that I would use. The one thing I'll throw in, we've talked about the NAD supplements that help a lot with nerve health and brain health and anti-aging. If there was one of these nootropic style supplements that I would take consistently, it would be the NAD, because when they've studied that, what they find is that NAD will actually improve and slow the aging of our brain. And that's where the applications come in with dementia and Alzheimer's and Parkinson's. So that would be something that I would actually take every day. These other ones I would almost use as like task specific things. But hopefully that helps y'all out. If y'all have some questions about those things, PEMF, we got a question about like, what is the PEMF? That's pulse electromagnetic field therapy. We use that here in the office to improve blood flow. It does a lot to improve oxygen delivery to cells. That opens up microcirculation. So we actually have bigger pathways to get red blood cells into tissues. When we do that, like, we can heal wounds, we can help, improve muscle healing. We can get oxygen to these sites that haven't healed for years. And that oxygen and blood flow brings all of the healing agents in there. But when we're using it for something like this, what we're just trying to do is improve blood and oxygen delivery to the nerves in the brain. And we've got to make sure that we're doing that in a safe environment, but it does seem to help if we're combining it. Like, we take something that gets in the bloodstream, I want to make sure it gets where I'm trying to send it. So in this case, if I'm trying to get it to my brain, I can lay on a PEMF mat and relax for 15 minutes and open up blood flow and oxygen delivery to the brain, and then get up and just be, kind of in this supercharged state for a little while. So with any of these, really, if you wanted to combine that, and you really wanted to do this like very powerful, kind of nootropic routine, where you take it, you let it get in the bloodstream, and then you jump on a PEMF mat for a little while, you'll see some amazing benefits and kind of feel that supercharged feeling after. So, but that's where PEMF comes in this instance, in the nootropics, for all of y'all who are trying to, join the Limitless team and hopefully solve some world problems. We know we need some of that stuff right now, but try those things out. Let me know what you think about them. Need some of that. Yeah, get some. I wouldn't say it looks like the Limitless drug, but it definitely has like kind of a different look to it than just taking anything else. And it tastes pretty good. Like, it's got kind of just a light minty taste to it. So I'm a big fan of it, but give it a shot. Let me know if you try it. Send us a picture with your blue tongue. I know a lot of people who have been trying it are posting their little blue tongue pictures online, but that's my Limitless dive for you. Beautiful. Any other questions? What can someone do to avoid clenching while they sleep? So if we're sleeping, it's very hard to, and I've suffered with this. When I was a kid, I would wake up and my jaw would just be locked. And a lot of that wears away your teeth. You start to create a lot of trauma. I know a lot of people will crack teeth whenever they do this. I actually broke a tooth. I had worn away the front teeth because I would sit there and grind so much that I shattered one of my teeth. So one of my front teeth is like a half fake tooth. So I've experimented with everything you can think of. And most of the studies, when we start looking at why people will clench whenever they go to sleep, is kind of a bit of a nervous system response. And they relate a lot of that to your ability to kind of shut down and to kind of turn off the stress response. So one of the things that helps a lot whenever we start to dive into how do we relax this stuff, it starts with doing some things that relaxes the sympathetic nervous system. So if you are going to sleep and you're actually still getting good sleep, but you're clenching, some of the things like, starting a meditation practice sounds kind of ridiculous. They've shown some really good improvements for people who do clench when in their sleep, for combining meditation with treatment for it. So doing that, taking like a hot Epsom salt bath before bed to get that magnesium in to help your body shut those muscles down is really helpful. I would say start taking like a magnesium supplement on top of that. We've talked about it a little bit before, but magnesium glycinate won't cause as much of a laxative response. So that's probably a good one for you to add in if you are doing like an Epsom salt bath. That way you're not overloading your system with magnesium and you'll get that kind of laxative effect. But the other part that we can do at home would be, before you go to sleep, like when you lay down, start trying to do some stuff that activates the parasympathetic nervous system, meaning like any type of stretching. If you can start rolling out, I would get some of those tune-up balls y'all have seen me talk about so much and start rolling out the neck. Y'all have seen us, it's the small one, but I'll show you with this one because I have it. Start just gently rolling out the muscles in the jaw, the muscles in the head, start loosening those up. And we're not doing this real hard. We're not trying to dig in and change it right before bed because that'll probably be too much of a stimulus. But if we can just start trying to relax those muscles a little bit, you'll, one, relax the muscles that are tightening up on you. But any type of stretching activates that parasympathetic nervous system and really kind of brings you down into a more relaxed state. One, you'll get better sleep. We've talked about how important that is to all of the areas of our health. But two, you'll start to get longer periods of time throughout the night where your jaw is not clenching. And in the beginning, that's what we have to do. We've just got to start kind of relaxing that for longer periods. Another good thing to start doing is L-theanine. L-theanine is an extract that we get in green tea. What I'll do is take that tea and make my little nightly cocktail, to help with sleep. So what you might do is brew some green tea like an hour before bed and put a little bit of honey in there, a little bit of apple cider vinegar, and you're getting all of those compounds. If you are taking a magnesium supplement, you can put that in there too, or kind of take it at that time. And so that would be something that's really going to help you shut down, and it's going to give you that theanine that you need to help relax some of those muscles and calm that down. So that would be a really good thing to kind of start to wrap in your nightly routine. We talked about doing ashwagandha for memory and for kind of brain health. Because of what it does for the brain, it does seem to help people relax and kind of calm down some. So that would be something, if you take it before bed, experiment with that. But if you take that and glutathione before bed, you're going to drop into a more relaxed, deep sleep. So, that might be a really perfect nightly routine for you where, you drink your tea, we get some magnesium in, we get a hot Epsom salt bath. We spend a few minutes after the bath just kind of rolling out the jaw, rolling out the head, rolling out the neck. I would stretch out the chest and the upper back while we're at it. So we take all the tension off the upper body. And then we take our, glutathione and ashwagandha right before we go to bed. And, we've created this really nice nightly routine to try and relax all of the head and the neck and the face. That's the stuff that you can do from a treatment perspective. I would say in the short term, while you're working on it, get a guard, go and find someone who'll make you a guard. I know they're expensive, but look, so are teeth. So I would definitely get one of those. get treatment for it. At some point in my life, I may or may not have sat there with a box of needles and a sharps container next to my bed, and before going to sleep every night, I released the knots in my head and in my jaw. And after about 6 weeks, I just stopped clenching my teeth. And so what we'll do here in the office is like loosen all of the muscles in the neck, correct all of the joint positions in the jaw and the upper neck. Those are really kind of interrelated. Release all the knots and the pressure points throughout all of the temporalis muscle, the masseter, all those deep muscles in the jaw that actually create the clenching. So we'll do that with dry needling. It works really, really well for that. If we're going through a course of that and it's just not working, I've had a few patients go and do Botox and actually release that. The thing I'll say about that is Botox gives you a window. Like Botox gives you a couple month window. So if you do that, you're going to get some relief after. You still need to go and do all the stuff we're talking about. Like we'll still bring them back in and balance all the joints in the neck and stuff. We'll still get them to do all the stuff at night, because if you don't do that, you're going to go through those few months. And as the Botox wears off, the clenching is just going to come back and you're going to get stuck in that perpetual cycle. So use that window of opportunity if it does get to that point where you need Botox to actually make some changes so it never comes back. And that might be, working on joints, working on muscles, working on tissue mobility and fascia, starting to create a meditation practice, start creating that nightly routine to keep everything kind of shut down and calm down. So that's a really kind of good way to go about treating this. It's usually not overnight, but most people who get good treatment for it really get a lot of improvements with it. I rarely, if ever, wake up clenching anymore. I can't even think of the last time that I have had that episode. So this stuff works. It works really well. And if you're getting that and you go through that sequence, kind of go back and re-listen to that. But you'll get a lot of benefits out of it. So Yvette, NAD is a supplement that your body makes, a compound that your body makes that we have found very significantly changes the aging process. And what they find is that it even more intensely changes the aging process of the brain and the nerves. So what a lot of research has been done on that is how do we elevate that and keep that at good levels? We can't take NAD as an actual compound. Your body won't absorb it. So they've had to create some ways to actually get that in. So what we use, the compound that we recommend that has the most research behind it, is something called nicotinamide riboside. When you get that into your body, your cells will pull in that nicotinamide riboside and actually put it together as an NAD compound. That helps with most things that you can think of that are involved in aging. They've shown it to do well with dementia, Alzheimer's. They've shown it to do well with DNA aging. So the telomere on the end of a DNA that tells us how much we've aged, how healthy is your DNA. If people have good NAD levels, they can correlate that with better telomere length. That's kind of a correlation, but hey, I'll take that for right now. So there's still a lot to be done on it. There's a lot of studies out there that are being done right now, but NAD is one of those that we're kind of cautiously optimistic that if we can continue to study it and learn more about it, that we might be able to do some really good stuff from an anti-aging standpoint on it. But for all of our patients who've had a history of nerve injuries, a history of kind of immune issues, NAD is something that I recommend because there's so much data behind it. So if you have more questions about it, check that out. We're trying to get and put out more and more information on it. So it's a good one though. And so clenching their teeth, hopefully y'all got a lot out of that. I would also, now that I'm thinking about that, start stretching the neck. We've got that little strap stretching video. That would be something that I would start taking a look at and start stretching that upper neck to keep all of this stuff loose as well on your own. You're welcome. And start getting all of that stuff as loose as you possibly can so that you're kind of relieving all of that tension and we're calming all of those muscles down. that's kind of a nice thing to combine with your little nightly relaxation rollout routine. So beautiful. Well, I hope some of that was helpful for y'all. I hope that y'all are leaving feeling a bit smarter. Y'all feel a little bit more encouraged with some of the help. As always, if y'all have questions, please reach out to us, send us a message, shoot us a text. If you need any information or anything, our team at the office is absolutely amazing at getting that stuff out to you. So until next time, thank y'all for joining us. Please let me know if y'all have any questions, and remember, just get a little bit healthier today. Do that one thing that'll get you a little bit healthier today. So awesome. Great. Thank y'all. Have a great day. Enjoy it.